this particular outbreak, we've now got 8 cases. We don't know where the source is. We know that there is spread within the community, and it is going to take a concerted effort to make sure we can get on top of it.
Why has it been so hard to trace the source?
Well, since COVID pandemic finished, increase in travel overseas, decrease in immunisation programs overseas, meaning that there are a lot of outbreaks of measles in the countries that Australians visit, mean that Australians who are travelling overseas are bringing it back into Australia. So we're having these repeated incursions of measles into Australia, and each one of them, sometimes it's just a single case and it's got on top of, and that's the end of it. But sometimes we miss the early cases and we get spread in the community with various cases, which just makes the job that much harder to get on top of.
And it's highly infectious and very serious.
Yeah, measles is the most infectious disease that we know of, and it is very serious. Australia has had elimination of measles since 2014, but it is a very serious disease. There's 50,000 people, mostly children, who die every year from measles overseas, which is a far cry from what it used to be prior to vaccination. And even now, for every 1,000 cases we get, there'll be a death. So, and apart from deaths, people can also get very serious complications such as pneumonia, middle ear infections, inflammation of the brain, and it can take some time to get on top of. And maybe a quarter of people who get measles in Australia will end up in hospital. It is a very serious disease.
What's the take-up of the measles vaccination like in the state and in that particular region?
Well, measles vaccination for childhood vaccinations, it's around 90%. Now that's not enough for what we call herd immunity, which is the amount of vaccination or immunity in the community that you need to have to make sure that a disease doesn't spread within that community. So we're not quite there yet. It takes a concerted effort from our public health folk to get on top of it. So that's part of a major part of our response. But we are urging people to make sure they know what their immune status is. If you're over 30, you have probably only had one vaccine. If you're over 60, you would have had measles as a child, so you have lifelong immunity. You need 2 vaccination doses to get immunity to measles. And if you're unsure, or if you think you've only had one or not vaccinated at all, make sure you think about getting a vaccine, especially if you're in the Pilbara region, and especially if you are travelling overseas, especially those countries that Australians frequent, like Indonesia, Bali, Thailand, and other countries as well.
And what are the possible symptoms that people should look out for, apart from that red rash?
Well, the red rash only comes on, say, 4 days after the early symptoms, which are a cough, sore throat, headache, just feeling very unwell, and a fever as well is fairly typical. Then the rash starts, and that's when people twig more clearly to the fact that this might be measles. So people can be in the community for some time without knowing that they've got measles, and of course spreading it to those who aren't immune. Fortunately, most people are immune to measles because of our high vaccination rates, or if you're over 60, you would have had it as a child. But there are certain pockets out there or certain people that aren't immune, and they're the ones that get picked off.
So are measles vaccinations being stepped up in light of the situation, and how quickly does a vaccination provide protection?
Well, it probably takes a week or 2 before you can get protection against measles. We say that you should get vaccinated if you're travelling overseas, for example, at least 2 weeks prior to leaving. With this outbreak that we've got in the Pilbara at the moment, we're urging people to know what their measles vaccination status is. The access to vaccination has been increased, and it is increasing, so people can get vaccinated by their GP or via various community clinics, which are all listed on the website, or via pharmacies. So we're putting a lot of effort into that at the moment to make sure that there is enough vaccine and enough access there for people who want to get vaccinated to get vaccinated.